In this video, Dr. Keith Nichols talks about the causes of low testosterone symptoms. Why is testosterone optimization therapy still a taboo? And testosterone resistance syndrome. What is it? What causes it? Stay tuned.
I'm good. All right.
Okay, so good evening again, Keith.
Good to see you, Steve.
I'm so honored to have you on the show. Finally meet you live from the channel.
Yeah.
So for the viewers that don't know you yet, can you please tell us something about yourself, your career, and how you get doing what you're doing?
Well, I'm board certified in physical medicine and rehabilitation, which is a physiatrist, and of course our whole specialty is based on maximizing function. So I'm here in the U.S. and in Tennessee, born and raised in Georgia. I practice spine and sports medicine prior to doing hormone replacement therapy. So I've been a team physician for the Nashville Predators of the National Hockey League, the Tennessee Titans of the Football League. I've done many UFC fights, a ringside physician for all those. So I've kind of enjoyed being around a lot of the pro athletes in the past and paid attention to how they maximize their function and what it took to become a pro. But ultimately, as some of us, as we age, will go through, I went through what you'd call male andropause. In my early 40s, late 30s, I began experiencing a decline in energy and extreme fatigue. You name it, I had it, and I couldn't get any good help. Even though I was a physician, I couldn't get diagnosed, and I was treated with medications like we all are, such as antidepressants, sleeping pills, you name it, just treating the symptoms. And to make a long story short, after a long period of mismanagement and mistreatment by my own colleagues, I finally had to self-diagnose. And then even after I self-diagnosed, going and getting treatment then wasn't quite so easy. And the kind of treatment that I got was a mixture of good and bad. And after my own personal experience, I decided, you know what, there are plenty of guys out there that are like me, but they don't have the opportunity to diagnose and treat themselves as we physicians sometimes do, or at least have colleagues that can assist us with our treatment. So I decided at that time that I would devote myself to becoming a specialist in hormone replacement therapy for men and women. And that's what I've been doing for the last decade or more.
Yeah, great. Where did I hear all these kind of stories before?
Yes.
Yeah, it's the same here. A lot of doctors don't even know anything about it, really.
Well, Stephen, I didn't know, and so I'm big to point out on other podcast or interviews that you're familiar with that I was one of those doctors too. I didn't know what I didn't know, and until you go through something personally yourself, it can be hard to understand, especially when you're not taught about it. And this is something that none of us are taught in medical school or in our residency. So it took me going through it to change me as a physician, as well as to change my way of thinking with regard to medicine as a whole.
Yeah, exactly. So I wanted to ask you, why much more than in previous generations, so many 30, 35, 40-year-old men suffer from low testosterone symptoms? Why is that exactly? What's the cause, in your opinion?
Well, we know that men's testosterone levels have been declining at a significant rate over the last several decades. And Stephen, to be the honest answer to that and the direct answer to that is that decline in men's testosterone levels directly parallels the increase in chemicals that have been produced in the world. We've gone from, for example, 50 million tons of plastics produced in the 1970s to over 300 million tons now. We're talking about other chemicals such as pesticides, herbicides, fungicides. All those are known as endocrine disrupting chemicals, and they have shown to have an impact. You can only test them on animals or cells. You can't really give a human a endocrine disrupting chemical and see what it does. So this field of biology is in its infancy. It's a brand new field of biology, by the way. But why we are seeing the significant decline in testosterone levels and why we are seeing men with symptoms of deficiency, despite having normal levels of hormones, is directly, in my opinion, due to the toxic environment that we are in.
Okay, and does that include anti-conceptive hormone pills for women? Because
Absolutely.
that's what I hear a lot.
Yes. Well, when you start studying endocrine disrupting chemicals and how they affect hormones, what we really, the three main areas that they've studied are the thyroid receptors, the estrogen receptors, and the androgen receptors. My actual area of interest is with the androgen receptors themselves, but there's also just as much going on when it comes to stimulating or blocking the estrogen receptors and thyroid receptors, along with the androgen receptors that I study. So yes, of course, the birth control in the water is affecting us all.
Okay, and so even it's more prevalent than in previous generations. But why is the optimization, the testosterone optimization therapy, still such a taboo worldwide, in the United States, in Europe, and so on?
Well, once again, it's something that we're not taught about. We have no training. You didn't have any training. I didn't have any training. Nobody that's in medical school right now, residency, or is getting any training in hormone replacement therapy. And my personal opinion on that is it's politics and economics. Medicine is a business. Hormone optimization is all about preventive medicine. It's about preventing disease and maintaining health. Medicine, the medical community that we're in, we depend on people being sick and needing surgeries. I mean, as well as I do, if you've been in a hospital, worked around a hospital, that when those beds start getting empty, those people panic. When the surgery centers are not full of surgery, the surgery centers panic. We need sick people. We need to treat, we're trained to treat diseases with medications or surgeries. That's we're trained by the pharmaceutical companies. And that's just the way medicine is. Medicine is, we as physicians are trained to diagnose and treat disease, not prevent disease.
Oh, yeah, exactly. It's sad, really.
It is. If everyone were healthy, the whole system would implode. And that's just the truth. I want the listeners to understand that medicine is big business. Your biggest lobbying group here in the U.S. is the pharmaceutical industry. So, they don't want you dead, but they don't want you well either. They need you on these medications. They need us to be kind of maintaining a healthy sick, if you will. I had using the word healthy, but we need to be treating. That's why when you do go to a physician, they treat your symptoms. They don't really, reverse the disease like we try to do with regard to preventive medicine or hormone replacement therapy.
Yeah. Have you seen our Belgian Minister of Health?
I did. I saw a picture and I laughed out loud.
Yeah, it's unbelievable. It's unbelievable.
You do a good job with your videos. I enjoy them very much. I mean, I'm a big fan. I found you kind of surfing, and I've been following you ever since. I guess you know that, and so I always try to give you a shout out anytime I can. Anytime I'm doing an interview somewhere else, I always point out that this is your channel is one that they must watch. So,
thanks. So what I found very interesting is you talking on the other channels on the podcast about testosterone resistance syndrome. I thought that was very interesting. Can you explain what that is exactly?
Well, sure. What we do when we focus on how we diagnose endocrine disorders or testosterone deficiency, we focus on a lab value, a number. And that number is outside the cells. So you can experience a deficiency when it comes to a hormone by both extracellular and intracellular mechanisms, meaning things that go on outside the cell and things that go on inside the cell. When we do a lab value, we're simply measuring the amount of hormone in the serum, in the blood. So we need a certain amount to exert an effect. So for instance, with regard to testosterone, we of course measure a total testosterone and a free testosterone. The free testosterone represents about 1 to 3% of total testosterone, but that's the active form. That's actually what's usable to us as men and women. Now, you can have decreased levels of hormones, and those are extracellular mechanisms. That's what we see with regard to type 1 hypogonadism or type 2 hypogonadism. Also, if we have increase in protein binding, such as albumin or sex hormone binding globulin, they can decrease our percent free testosterone, so we have less that are usable. But testosterone resistance syndrome focuses on what goes on in the cell. For testosterone to exert an effect, which essentially it's anabolic, so it its protein synthesis, it has to actually enter the cell. And once it enters the cell, it has to go through several steps in order to exert an effect. The most important step is the binding to the androgen receptor. Anything that prevents binding to that receptor will not allow testosterone to exert an effect. So you can have as much as you want outside the cell. Once it enters the cell, if it can't actually bind to its receptor, like a key entering a lock, nothing can happen. So it has to bind to the receptor, number one, and we can have an increased number of receptors or decreased number of receptors. We can have decreased receptor sensitivity from a genetic standpoint, but also that's where the endocrine disrupting chemicals come in. They actually bind to those receptors and they block the androgens from actually binding to its receptor so it can exert a response. The second mechanism, once it binds to the receptors, has to enter the nucleus of the cell where a process called transcription occurs, and that's where a copy of DNA is made. That copy of DNA is then taken outside the nucleus and then goes to what is called a ribosome, and that's where protein synthesis occurs, and that's called translation. So you've got androgen receptor binding, transcription, and translation, these three major processes that must occur inside the cell before testosterone can exert an effect. Anything that affects any one of those three processes will cause symptoms of deficiency, even if you have normal levels outside the cell. And we in medicine simply measure what's outside the cell. We do not measure, or we can't measure what's going on inside the cell in each human being. So I'm treating these men with so-called normal levels, but have all the symptoms of a deficiency because the problem is inside the cell, the intracellular mechanisms, not what's going on outside the cell.
And do you have any idea what the ratio is of men having low testosterone symptoms with low testosterone versus the other men that have normal levels with low T symptoms?
That's where there's a lot of individual variability when it comes to testosterone levels in general. You can take two men with the same level, the 600, one can be very symptomatic, the other can have no symptoms at all. And once again, do you really get down to, does one man have more receptors than the other? Is one more sensitive than the others? Has one had more exposure to EDCs, or is receptors being blocked? So that's where, you don't know, but that's where we do treat symptoms. So if I have a man come in, it's not so much the initial number that I'm looking at, is I'm trying to treat his symptoms. Now, the endocrine societies, as you know, and other societies will tell you that if those levels are normal, that we should look for other causes of those symptoms. So if they come in and they're fatigued and they, are too tired to do anything, what's the first thing they're going to get is an antidepressant. If they can't sleep, they're going to get something to help them sleep. If they can't get an erection, they're going to get, something to help them get an erection. We're going to treat all those symptoms without really getting to the cause. And the reason is we're trained to treat a lab value. We've turned into a lab-centric medical society versus a patient-centric. We used to treat patient and their symptoms. Now we treat a lab value. And if that lab value is normal, we do not consider other diagnosis. We just treat symptoms. So that's typically what ends up happening. And I think that, we did not see this 20 years ago. You didn't see 30-year-old men coming in with symptoms of low testosterone. This is a fairly recent event that's been occurring over the last several decades, but once again, it directly parallels the increase in our chemical exposure.
Yeah, so you agree that patients with testosterone resistance syndrome should be treated as well?
That is the only treatment. We the sad state of affairs right now is that you can't avoid the exposure. If you test 100 people, every single one of them will test positive for EDCs. So we can't avoid the poison because we don't know half of them that are out there. They're not tested. We don't know what we're being exposed to. They don't test them in a mixtures. They just test them one at a time anyway. And the way they're tested is not how we're exposed to them. So there's a lot of flaws right now. And once again, I'll point out that it's in its infancy. This is a new field of biology. But nonetheless, the treatment is you have to outcompete the EDCs for those androgen receptors. If we can't bind to those receptors, then we can't get a response from any hormone. So yes, I believe that's the treatment. But until mainstream medicine acknowledges the existence of what's occurring, then we're going to continue this battle, and all these men are going to continue to be undertreated or not treated at all, and they suffer. But I guess turnabout is fair play. What we are starting to experience is what women experience through menopause, which is, which is a terrible experience for them. They all need to be treated. It's endocrine failure for them. But so us men now are getting a little taste of our own medicine there.
Yeah. And what are the testosterone levels, the expected testosterone levels at what their symptoms may clear? That's probably then above the physiological ranges.
That's totally an individual response. Since I treat symptoms, then I will start with a dose, and I will monitor their symptoms every 4 to 6 weeks. And then once their symptoms resolve, whatever that number is, it is. And, typically if you're dealing with a 40, 50, 60-year-old gentleman, when I typically see someone that comes in with significant symptoms of testosterone deficiency, their symptoms typically resolve on average. People ask me, I'm not following a number, but they'll ask, what level do you typically see them resolve? And it's typically with a free testosterone level between 30 and 50.
Yeah. Okay.
And that may translate to it. And these are American numbers. Okay. Of course, these are not your numbers. You'll have to convert for us there. But that may correspond to a total testosterone here in the U.S. to being 1200 to 1800 maybe, and that's considered super physiologic. But as you know, what is normal, what was normal before July 17th, 2017, is now super physiologic. And what that means for your viewers is the testosterone levels, normal levels, have significantly declined. So our new normals are much lower than they were prior to 2017. And prior to 2017, a normal level, upper limit of normal was over 1500 in certain labs. Now the normal level is 916, the high normal. But what's most important is the low normal has gone from 348 to 264. That means if your testosterone is not less than 264, your doctor will not treat you for testosterone deficiency, even if you're severely symptomatic. And not only will they not treat you, they make the test, they skew the test so you will be denied treatment in most cases, because a man's testosterone level has what we call a diurnal variation, and that means it's higher in the morning hours. So they force you to test men at 8 o'clock fasting on at least 2 occasions, and they have to fail that test, other words, be less than 264 on 2 occasions in order to meet criteria. And most men will not meet that criteria.
Yeah, exactly. It's the same numbers here. It's 250 till 950 on the laboratory sheets. Yeah. And you have to test it in the morning as well. Yeah.
So now when we treat someone, if we would have treated them a year ago, and let's say we got their levels up to 1100, and because the normal was 1197 then, that would be completely fine. That's normal. You're within the normal range. Now, if you put somebody at 1100, they're super physiologic. You're doing really bad things because the new normal is 916. So just within 1 year, you've gone from something that was normal to now being super physiologic and considered taboo. But us men, even though our testosterone levels are declining, we have decreased production. We're not responding to the testosterone we have due to the blockage of the receptors. We're not in any less of a need from testosterone than what we needed 100 years ago, though. We need just as much, maybe more. I mean, of course, I think we need more than we did at that time to outcompete our toxic environment. But instead, we're forced to give men less. I can't tell you the number of men I see that come in that their doctor will only treat them to a certain number, and that number would have been a pathetic number 30 years ago, but now it's considered high, or you should be well. They tell them that, well, you should be well now. Your testosterone level is 500. Well, 500 was, 1/3 from the bottom whenever I was first diagnosed, with 1500 being normal. So, it's become a very restrictive environment, and men are truly suffering unnecessarily.
Yeah. It's sad, really. Even a young urologist here, friend of mine, says, I only give androgel to treat these low T symptoms, and if you want the injections, you just go to a transgender clinic. Really?
That's just, it's terrible until maybe he goes through it. Maybe he'll be lucky enough, like I was, to experience what that feels like, to go through it, and he will change his mind. He'll definitely change his mind. But it's sad that it would take something like that for that to happen. You know,
he's not, even he is not really interested, because I send him the studies on the testosterone cream and the scrotal application. I send him the studies, and he answered me in the mail, "You must be joking," he said.
Yeah. Well, like I said, he doesn't have an open mind. I hope our viewers understand, when you get into the medical system, it's almost like a military system. You're trained very rigidly. You're trained within these very narrow parameters. You know, normal is normal, and so we don't question authority. It's yes sir, no sir, no different than the military, and so we come out with a very rigid way of thinking. We're not open to new ideas. If we've learned it one way, then that's the way it's always going to be. We're not open to new ideas, and so that's really the problem. And and it is a sad state of affairs, and only the people out there suffer, until they find a physician such as yourself that's well educated in it. But it took you going through it to understand it as well.
Yeah. Well, I'm glad I found the TOT Revolution channel, and you as well, Keith.
I'm happy to.
I learned a lot the last years.
Yeah, if you've done a great job of teaching on your website. Like I said, I'm a big fan, and I watch it. I watch it every morning, every week. That's part of my routine is have coffee, read the paper, and go through my favorite YouTube channels, and yours is right there at the top.
Yeah, thanks. So thank you so much for providing us with all this amazing info. And just to close it down, maybe, how can people reach you if they want to work with you?
Well, they can always, I get emails from all around the world now, so I'll be glad to answer them. I'm glad to help you out. I mean, I think you found that out yourself. So wellness at T1 Institute. So it's wellness at the letter T, the number 1 institute.com.
You're too kind, Keith.
Well, hey, like I said, I'm a big fan, buddy. I feel privileged to be on your podcast.
Thank you so much.